Free State Premier Maqueen Letsoha-Mathae has stressed that health facilities will be under the spotlight until they function optimally. Members of the Provincial Executive Council visited various hospitals across the province as part of Mandela Month program. Health has become the focus point of the Free State provincial government since the swearing in of MCs. The Office of the Premier and the Health Department have visited hospitals to investigate concerns raised by the public. All right, and for more on this, we're now joined by Free State MEC for Health, Monyatso Mahlatsi, and he joins us now via our video link to discuss this a bit more further. MEC, thank you so much for your time this evening here in SABC News. I mean, one would say that we have indeed noted those reports of, the provincial government seemingly to be prioritizing healthcare facilities this time around in the province. Why specifically are you focusing on hospitals in the province?
Thank you very much for the opportunity, and good evening to you, your team, and your viewers at home. Our Premier, when we were inaugurated, emphasized the point that health is a fundamental right within our country and our province. And as a result, she prioritizes that as one of the key areas that we need to get, functioning optimally. And that is why we have gone all out to focus on our hospitals as our primary institutions of providing healthcare services.
Most of us think twice before visiting a public health facility, and that's because of what it has become known for. I mean, we also have seen reports and stories of, the ill treatment of patients and the long queues and sometimes not receiving the necessary help, that one needs. Upon your observation, are you proud of the state of the Free State's healthcare facilities?
I'm not proud of the state of our health facilities, and I've got to understand the challenges that are facing the department from internally, because when you look at it from outside, you have a view, but when you come inside and you begin to realize some of the things that are creating a challenge, which includes the budget cuts and other related issues, you then begin to understand that there are a number of things that need to be fixed. And that is why I have made a commitment that the call by the Premier to make this institutional functional, I'll give it my best shot. And that is why we have, even with the team of management, made an effort to try and bring back the culture that seeks to prioritize our people in a form of what would be the principles, and making sure that our patients and our clients receive quality health care in various institutions. And that's our focus between now and into the foreseeable future, yes.
And upon your investigations as a department and as a province, I mean, you've done the rounds at a number of the facilities in your province. Which one would you say has come out as the most problematic hospital that the Free State, province needs to deal with?
We have prioritized Pelonomi for a number of reasons, and one of the key reasons is that Pelonomi should represent the beacon of our health facilities in the province, and we're focusing on it, and we have realized that because of its massive nature and because of the types of services that are rendered here and the level at which they are rendered, it will need even more support to get it back to the state it used to be. Because I was also briefed that at some point Pelonomi was an institution which other provinces and even the African continent came to benchmark with. And my question was, where did we drop the ball? And we're going all back there with a team of management in health to go and look as to where did we drop the ball, pick it up and start making sure that we don't drop the ball again.
You're also facing a number of challenges and problems when it comes to water challenges, particularly, I know for a number of years, just covering some of the stories in the Free State, particularly in Qwaqwa and, looking at the Mandela Hospital. I mean, they've been struggling with water for quite some time. When it comes to the interventions being made there, how far are you going as a department to try and sort out the problems being faced at the hospitals in Qwaqwa?
I've put together a team of experts from the Department of Health, from the provincial government, other departments like Public Works, and the Premier has given us a go-ahead to go on with that team. And that team also includes members from ESCOM, members from Water, members from Department of Water and Sanitation, all the stakeholders that play a key role in making sure that our facilities do not suffer from unreliable electricity and water supply. So we're using Manapo and Elizabeth Ross in Qwaqwa as a test case. And once we can be able to resolve that, we're going to spread it right across the province, because we are not only facing that problem in Qwaqwa, we're experiencing that problem even in areas like Paris. There's a clinic there that's struggling with water supply in that area, but it's something that is chronic to bigger parts of the province. So when we get it right at that level, we're going to use the same strategy to address that problem and make sure that none of our facilities suffer from unreliable supply of water and electricity.
Earlier on, you spoke about, going back to the drawing board and looking at, where it went wrong. Where would you say, and looking at the issues being faced by a number of, the health facilities in the Free State, where would you say that, how deeply rooted are these issues when it comes to healthcare services to the people of the Free State?
Could you please rephrase your question? I think I missed a point somewhere.
How deeply rooted are the problems and challenges when it comes to healthcare facilities in the Free State?
The problems are quite deep, and one considers, can see it just on the basis of the responses of that we receive from the clients and the patients that we treat. But I must indicate that we're suffering from negative stories that that receive more attention than the positive stories that are coming from our facilities. When we look at the stats and we look at the complaints and the quantum of complaints that have come in, we realize that our institutions generally, they're performing quite well. But it's just that the issues that are negative and those incidents that didn't go well are the ones that draw a lot of attention. But when you look at our stats generally, our institutions are not that bad. Of course, there are challenges within it. So there are problems within our institutions, but at the same time, there's also a number of positive stories. So the only problem is that these others that are negatives are the ones that are overshadowing the others.
How long will it take for the Free State government to resolve the problems it faces in its healthcare facilities? I mean, we know that it may take a while, but what is your time frame and what is your target as a province?
We're introducing a new culture within the Department of Health that seeks to prioritize our clients and make our clients, which are our patients, to be at the center of all the decisions that we are making in the institution. We have started that process as the Office of the MEC, as well the top executive management of the department, and we cascading that understanding to the lower levels. And we believe once we can get the culture right, many other things will really fall into space. Yes, there are problems, but if we can get the culture right and up our game in terms of communication. For an example, if our clients are waiting, we need to make an effort and explain to them that this is the reason that makes you wait, because we have realized that in institutions like clinics, where our operational managers are beginning to explain to our clients that these are the reasons for the delay, we get a more positive feedback, and our clients are not anxious
right.
because they understand the reason. Yes.
All right, MEC, thank you so much for your time. That's MEC there from the Free State for Health, Monyatso Mahlatsi, just giving us an insight there when it comes to the prioritization of service delivery, particularly looking at, healthcare facilities in the Free State. And of course, that province is shining a spotlight there in terms of the services being received by the people of that province.